Okay, hopefully the last you watched the immune response, so now this will make a little more sense. So we're going to be looking at the different type of hypersensitivity reactions. And so the first one is our type 1. And this is where the person comes in contact with the allergen. And they have IgE released. And IgE, if you remember from the last video, is the allergic response. And when IgE it's protection. So when we get IgE, or we get that allergen, we're going to have the release of the mast cells. And the mast cells are what produce histamine. So the mast cells all of a sudden come to the site where there's the allergen that's been stimulated by the IgE, and they release the histamine. And if you all remember what histamine does, histamine causes that capillary permeability. And then we also will see the leukotrienes. The leukotrienes we find in our lung tissue, and the leukotrienes stimulate the white blood cell response. So when we're looking at our hypersensitivity, you can see my little video here, or my little cartoon, and all of a sudden we have the antigen, we have the mast cell explodes, and it causes the vasoactive amines and the cytokines being the IgE. So there's different types of hypersensitivity reactions that we can see intravascular. Intravascular is our anaphylactic shock. And we'll talk more about anaphylaxis in class. We can have the respiratory hypersensitivity type 1 reaction. And this is going to be your allergic rhinitis. This is going to be your asthma. This is going to be those patients that wheeze for no reason. It can cause bronchospasms. When we look at skin, this is our wheal flare reaction. And if you think about it, it's just angioedema. And we see this with mosquito bites, with patients that have gotten poison ivy, poison oak, where we have, again, the allergen, the release of the histamine, and we get that wheal and flare. We can also have GI, and this is our nausea, vomiting, and diarrhea as a result of some type of antigen that we've eaten. Our hypersensitivity 2 reactions, these are cytotoxic and cytolytic. And these involve the direct binding of IgG or IgM antibodies to the antigen on a cell surface. We see this activates that complement system, and the cellular tissue is destroyed. A classic type 2 is the hemolytic blood transfusion reaction. This is where our patient who, say, is A positive gets a B positive blood. The IgG or IgM are going to come, they're going to attack that cell. And so that's why when we have patients, that's why we check and double check, because type 2 hypersensitivity reaction is it can be fatal. When we have the cell lysis, or the actual destruction of those cells, it causes the release of hemoglobin into the urine and plasma. We're going to see acute kidney injury with this. We're going to see clumping of those cells before they get destroyed. So we may see some type of thrombosis with our hypersensitivity reaction. Our type 3 is where we have tissue damage. The antigen comes in contact with the IgG-IgM complex. It can't be removed. It's deposited in the tissue, and we're going to see destruction of the tissue. We've already talked about a little bit about this with systemic lupus, and we also have seen it with rheumatoid arthritis. Common sites for that deposit of the antigen antibody complex can be in our kidneys, our skin, our blood vessels, and our lungs. So we've seen it with SLE and rheumatoid arthritis. We can also see this with glomerulonephritis. We've discussed glomerulonephritis before. It actually will destroy the glomeruli. And then our hypersensitivity reaction number 4 is our delayed hypersensitivity reaction. This is a cell-mediated immune response. It is delayed. It can be up to 24 to 48 hours for the immune response to occur. And that's where we get the antigen, and then all of those T cells come. And then we we release the cytokines. We see this with our contact dermatitis. So we come in contact with something. Again, maybe poison ivy. We can see it poison ivy with our type 1s, and we can see it with our type 4s. Or maybe our antibiotic rashes. Okay, and if you have any questions, you can contact me in class. Thanks, and have a great day.